Welcome to day 3 of the Sugary Drink Summit. My name is Maisha Hutton, and I'm the Executive Director of the Healthy Caribbean Coalition, the only alliance of NCD-focused civil society organizations in the Caribbean. I am delighted to be moderating the plenary session of the Sugary Drink Reduction Policy, Success and Innovation from Abroad. This is an important area of work for the HCC. The Caribbean has the highest NCD mortality in the region of the Americas. And in some of our countries, up to 1/3 of our children and 70% of our adults are overweight or obese. Our unhealthy diets are chiefly responsible for this growing and unsustainable NCD burden. As a region, we've moved away from traditional diets to widely accessible and heavily marketed ultra-processed products. As small island developing, we lack food sovereignty. We are net importers, in some instances importing up to 90% of what we consume. And a significant portion of what we consume are products high in sugars, fats, and salts, feeding our twin epidemics of obesity and NCDs. Our governments are waking up to this threat, and we've seen an increase in commitments to implement policies to tackle obesogenic environments. Walking the talk, however, has been slower than anticipated. And so the HCC and our regional partners have invested heavily in advocating for nutrition policies, fiscal policies such as SSB taxes, regulation of the sale and marketing of unhealthy foods and beverages in and around school settings, and the introduction of mandatory front-of-package warning labeling. And we've had pockets of success. 4 countries have SSB taxes, with Bermuda having one of the highest SSB tax rates in the world at 75%. Currently, 4 jurisdictions have national policies banning the sale of some form of sweet beverage in and around schools. And this number is likely to grow in the near future. And this brings me to FOPL. We are currently voting on the introduction of a regional standard for the labeling of prepackaged foods. The standard includes the octagonal high-end warning label and the PAHO nutrient profile model. And this is a big win for us against the background of a protracted process which has been frustrated and delayed by private sector interference. So that's a snapshot of what's happening in the Caribbean. You will now hear from global trailblazers, Chile, Mexico, the UK, and South Africa. They are truly walking the talk. They have moved ahead with strong evidence-based healthy nutrition policies, free from conflict of interest, as demonstrated by the mounting evidence, scientific evidence, which is free from conflict of interest. This is evidence that we are all using in our own advocacy at home. Our first presenter, Dr. Guillermo Paraje, is going to share evidence from Chile. But before we move ahead, a quick housekeeping note. We will not be taking questions from the audience today. With that, I now invite Guillermo to present.
Thank you very much, Maisha. It's truly a pleasure to be here. And thank you very much to the organizers for inviting me to share Chile's experience. Okay, so what I'm going to present briefly is the evidence that we have in Chile about the effect that front-of-pack labeling implemented in 2016 had in Chile on some real variables. These are variables that can be counted in physical units. First of all, I have no conflict of interest to disclose. My work, some of my work that is presented here has been funded by Bloomberg Philanthropies through the University of North Carolina and by the food and agriculture organizations, neither of which had any role in the design of the work I am presenting. So this is basically in a snapshot what the front-of-pack law in Chile is. Basically, as you can see, Chile implemented these 4 black octagons in solid food and beverages. The octagons warn about excess of nutrients in sugar, sodium, fat, saturated fat, and calories. Together with these octagons comes a number of marketing restrictions, basically aimed at preventing children being exposed to food and beverages that have these octagons on them. The octagons or the thresholds to get these octagons in the package were implemented sequentially over a 3-year period, first June 2016, then June 2018, and then June 2019, to give the industry time to adjust. Now, some evidence. A recent paper by Smith, Talley and colleague found, for instance, that the decrease in the purchase volume of SSBs with at least one warning was almost 24%. Some people argue that this is the largest decrease recorded ever in SSB consumption. It was only apparently provoked by these warnings, and this is after the implementation of the first stage. So it's after June 2016 and before June 2018. We still have no information what happened after that, but we believe it continued. Another recent paper by Reyes and colleague found an important decrease in the proportion of products that had these warning labels, especially in sodium, where it reached almost 74%. At the time of the implementation of this law, producers of food high in sodium argued quite strongly that their products could not be reformulated because of some technological issues. What Reyes found that was not the case, and that even products high in sodium were reformulated quite importantly. In the case of, for instance, SSBs, these graphs taken from Reyes et al. Shows that in the case of sugars, which were present in SSBs, there was quite a high reformulation. As you can see, the green area moved to the left of the limit of the threshold, and that is showing basically that sugar SSBs reformulated their products to avoid having these labels. In terms of budget shares and prices, I'm conducting work now with a colleague that shows basically that there were no changes in relative prices. That is prices of high-gain versus not high-gain products. And also it shows that there was a sharp decrease after the first implementation of the law, so after June 2016, in the budget shares allocated to high-gain products, controlling by household variables such as gender of the household head, age, number of children, etc. So basically what you can see here is that, for instance, in the case of beverages, which is the graph to my left at least, is that the budget share in high-in beverages decreased quite importantly from almost 45% of total beverages purchased by household before the law to less than a third. The same can be seen in terms of the whole category of solid food and beverages. And in the case of one or more labels, there was also quite an important decrease in the budget shares allocated to these purchases. In terms of prices, you can see there that prices didn't change much, the relative prices. So products that are high in relative to products not high in are mostly the same after the implementation. So this basically shows that products that were not high in before the implementation of the law basically kept the same price, at least the same relative price. Now, in terms of employment and wages, which is a usual complaint of firms when discussing or when measures like this one are discussed in countries, a recent paper just published in Food Policy this year found that there is no effect neither on employment nor on real wages in industries that were likely to be affected by this regulation. So after the implementation of this regulation, employment and wages had a trajectory when compared to other other sectors that were not subjected to this law. After the implementation of the law, the relative trend was basically the same. So employment and wages didn't change. That doesn't mean that maybe in some sectors or in some firms, employments are the same, but basically what it means that as a sector, the employment didn't change. Quite likely, firms that were affected by these changes moved around employments from one line of production to another line of production, but that basically we could not observe that at the firm level, but at the aggregate level, the employment is again basically the same. So this I'm sorry, and another work by Corvalan and a colleague published by the Food and Agricultural Organization showed that after the implementation of the 3 stages of the law, so until December 2019, there was no change either in employment in the manufacturing sector. So comparing manufacturing to other sectors that were not affected by the law, there is no different trend or no differential trend that could be attributed to the implementation of the law. So this is to summarize what we found in employment and wages. So basically, the vertical dashed line is the moment where these warning labels came into place, and as you can see, when compared to the other sector trend to sectors not affected by this law, there was no differential change in both. So basically, that is enough to conclude that this law didn't affect wages at the moment of the implementation and after the implementation. In terms of employment and also in production, physical production, this 3 dashed line shows the timing of the implementation of the different phases of the law, and again, there is no differential change when comparing manufacturing to other sectors not affected by the law. So some conclusions. Of course, the evidence is quite rich. There's a lot to read about the Chilean case. I'm just showing the tip of the iceberg on this. There is strong evidence that these front of pack regulations had a successful reduction or were responsible for a large reduction in the purchase and consumption of hygiene products. It didn't affect prices, which is something that one could expect. And there is also a strong evidence on reformulation, which was one of the main objectives of the law. Producers don't like having these warning labels on their products, and do everything they can to get rid of these labels. So they reformulate. They try at least to reformulate. There was no real effect on either employment nor wages, as I showed you from the previous slides, which is again something that one could expect from a policy like this one. And the next necessary step for Chile, I believe, and for many countries in the region is taxes. So taxing the content in terms of these critical nutrients in food and beverages. There are already some proposals. Some of us already calculated the optimal tax in terms of how many pesos per grams of sodium or per gram of sugar these food and beverages should have. Of course, there is a strong opposition from the industry, but this is, I believe, what comes next. Thank you very much.
Thank you, Guillermo. That was an excellent presentation. Speaking from as the perspective of an advocate who's working in this area right now and really drawing on that evidence, the evidence that you presented has been really powerful for us to make a case for FOPL in the Caribbean. We're now going to turn to Mexico, and I'd like to invite Dr. Alejandro Cavillo, who is the director of El Poder del Consumidor, to present. Alejandro.
Thank you for this invitation. I think these kind of events are very important to share our experience to promote public health in our countries. I will present the point of view from the civil society, how we can develop campaigns. And first, I want to talk about the different steps for the campaigns. But every time that when we promote the public health policy that will have an impact in society and individuals, no, we need to share, no, and we need to expose that we need this policy. And there are some data about what was happening in Mexico in 2012 when we promote the soda tax. No, the data are very, very strong. In 6 years, previous 6 years, we have 500,000 people that die by diabetes in our country. And the soda consumption in Mexico was the highest per person in all the world. We consume at this moment 30% more than the United States citizens, no? And the global burden of disease, no, calculate that we have around 40,000 deaths related with soda consumption. And we have these 3 steps in all the campaigns that we develop. First, we expose the human drama. The people see that we need to do something in front of this human drama, and the people feel that they are victims. In the second step, we identified the culprits, no, and the people see the enemy, no, and in the third step, we present solutions, no, and we try to engage the people. And in the first step, we expose the human drama by many different ways. We are now, you can see a picture, a photo in front of the Health Ministry of Mexico in the Day of Death, that is a very traditional day in Mexico, no, showing that 500,000 people die in the last administration related or a cause of diabetes. And in the second part of this, when we need to go to identify the culprits of this situation in Mexico, no, we develop this campaign that focus in the soda drinks, showing that each bottle of refrescos, soda drinks in Mexico, have around 12 spoons of sugar. And we asked, no, if the people want to give 12 spoons of sugar to their kids, no? And this campaign is one of the biggest impacts that we have in around 12 years working in campaigns. And in the third step, we present the solutions. We ask for a sugar sweetened beverage tax to obtain money to introduce water fountains inside schools and public spaces. And the industry have a very strong reaction. You can see now in the left side a photo of the president of Mexico in this moment, invited by Coke, with a can of Coke with his name Enrique. No, and also we have a very strong campaign from the sugarcane industry that we know was this campaign was paid by Coke, that also have invest a lot of money in the sugarcane industry. And you can see there in the center, no, a food ad in newspapers paid by the public, by the beverage industry, saying that this tax came from Bloomberg because they know that we have money to do our campaign. And we react to this only when was necessary. This is a full page ad that also we pay in the newspapers saying where the soda tax recommendation came. And we said, and we put there no, some sentence from the World Health Organization, from the Pan American Health Organization, from OECD, from the United States Nations reported on right to food, the Secretary of Health of Mexico, the National Institute of Health, and many other actors, saying it is not came from Bloomberg. This came from the situation and the drama that we are living, and the principal international organization and promoting this. The results, no, and I know that Simon Barquera from the National Institute of Public Health will present or presented the results of the soda tax in Mexico. I only will say that we have only two reports published in Science magazines, one from the first year that explained that we have a reduction of 6% of sales of sugar sweetened beverage the first year, and around 9% in the second year. But also, we have it's very important to mention that we have a soda tax of 10%. No, that is a very low soda tax. We asked for a 20% soda tax. This photo in the left side, we were in the Congress, in the Senate, asking to increase to a 20% the soda tax. That was the recommendation, the international recommendation. I think it's very important to mention that this same year, no, a colleague, another activist that is in this photo, and the researcher from the National Institute of Public Health that is in the photo from the New York Times, and myself, we received an spyware in our cell phones with attacks at the same time that we were promoting to increase no, the soda tax. This spyware was Pegasus that have a control of the microphone, the camera. No, is terrible this act to people that were promoting actions to protect the health of the population. And at least I want to mention that this year we have a front of pack warning level similar to the Chile experience. We have a lot of contact in the Latin America region. These kind of octagons are also in Peru, is coming in Chile, is coming in Uruguay. But in the case of Mexico, with the experience of Chile, we introduced two more warning levels that you can see in this horizontal black warning levels that say contain caffeine or contain non-caloric sweeteners that are not recommended for children. We took the experience from Chile that many products remove sugar and introduce non-caloric sweeteners that we have data that is not a recommendation, is not a health recommendation for children, no, and we have some also analysis in Mexico about the impact in some hormones on kids from this. And this is a kind of Coke, no, that say excess of calories, excess of sugar, and have these two warning levels saying that have non-caloric sweeteners and have caffeine that are not recommended for children. And at the end, this warning level no have another regulations. One of these is to remove all characters. No, that is something that have in Chile also. Not that any product that have a warning level no is prohibited to have characters or promotions aimed to children. This is in general the regulations that we obtain, no, we achieve in Mexico with a very strong campaigns and coordination with the academy, no, with legislators, no, and with civil society. Thank you.
Thank you, Alejandro. That was excellent, really demonstrating the power of civil society in agitating for these policies and creating strong public demand. I particularly like the sharing about the non-caloric sweeteners. We've noticed in the Caribbean a reformulation towards products which in fact target children that are including increasing levels of non-caloric sweeteners, and we've tried to get that into our standards, so fingers crossed we'll have some success there. We're now going to move across to the UK. And I'm going to introduce now Dr. Modi Matswama, who is from the Wellcome Trust, and she's going to share the experience of the UK soft drinks levy. Modi.
Thank you, Maisha, and thank you for the invitation to present at this conference. I'm really excited to be here. So I'm going to give you a bit of the story of the introduction of the UK soft drinks industry levy, our sugary drinks tax in the UK, and I'll talk a bit about the how and why it came about, and then I'll end with some of the findings that around the impact that it's had so far. So one of the major drivers for the introduction of this soft drinks tax was the introduction of a new scientific sugar guideline for the UK led by government scientists, which was published in 2015. And basically the government had spent about 8 years, this scientific committee, reviewing the evidence on the links between sugar and health. And as a result of the review, recommended a new target for sugar intake for the population, which basically halved from a recommendation of 10% of energy to 5% of energy. So a very significant signal that sugar was very much worse for people's health than had previously been thought. And this report was published against a background of very high levels of obesity. In the UK, we have some of the highest levels in Europe, if not the world, for example, and other diet-related diseases like diabetes and heart disease. And so the result of this sugary drinks new target, for sugar, meant that overnight, there's 2 lines on this graph showing the sugar intakes in the population by different age groups across the bottom, and the percentage of the population exceeding the previous target that was set in 1991 versus the 2015 target. And the result of this new report meant that overnight, the proportion of the population who are now considering eating more sugar than the government target increased significantly. So the red line shows how it had gone from a problem that was primarily concentrated, particularly amongst young people, children in the ages between 4 and 18, to suddenly all age groups were eating excessive amounts of sugar. And that was then being associated with high rates of things like tooth decay, diabetes, etc. And that was a real kind of impetus for action by the government. So just ahead of this report being published, around 6 months before, Public Health England, which is the government agency with responsibility for health, came to me and my organisation. At the time, I was working in a civil society organisation that worked very closely with government, and they came to my organisation and asked us to undertake an independent review of what the potential options that the government could take to help reduce sugar and tackle obesity. At this point, the report hadn't been published, and they didn't give us an indication that the recommendation was going to be different, but they nevertheless started this process of identifying what they could start to do once the report was published. So I undertook a rapid review of the Graham published literature to identify what the experts, the scientists, were saying needed to happen and were recommending as options for action, as well as investments, the investment community like Credit Suisse, as well as international bodies like the WHO and OECD. Around 45 potential options from farm to fork were identified and published in this report. And then together with this government agency, we had consultations on the findings with an industry group and then a separate one with the public health and health professional groups to get a sense of where the priorities lay, or where the different groups felt the priorities were. And those consultations led to very different views on where the priorities for action should be. The public health groups came up with priorities like taxes on unhealthy products, restrictions of marketing, particularly junk food marketing on TV, and then other types of regulatory activities. the food industry came up with solutions like educating the public and using role models to play a role in education. So there's the recommendations for the different groups were poles apart, but it nevertheless gave the government a sense of where there was going to be political support for action. So that process, as following on from those consultations, the government then undertook its own evidence reviews to help inform its own strategy, and then published the Childhood Obesity Action Plan in 2016. This was the first of several chapters, or we've now had 2 chapters. And the public health community, we were delighted to see that our priority recommendations and more ended up being adopted within this childhood obesity plan. So our recommendations were including things like reducing price promotions, which are a big driver of consumption of unhealthy products in the UK, reducing junk food marketing, setting clear definitions for high sugar foods, which could then be taxed, for instance. The introduction of an actual tax on sugary drinks was included within the plan, and so we were very delighted by the strategy that came out. Some of the enablers, we hadn't necessarily anticipated that this kind of policy was going to be adopted, but there had been early indications that there were politicians such as our Prime Minister from as early as 2011 had mentioned that the UK could introduce a fat tax. And this was around the time when several other countries in Europe, such as Denmark, were starting to introduce their own taxes on either saturated fat or sugary drinks, for instance, in the case of France. But although we had heard these political noises, nothing had come up of them. At the same time, there were also several expert and scientific papers being published and being written about in the media showing the health benefits of introducing a soft drinks tax. So there was increasing awareness in the public discourse of the important role of sugar on health and the impact of a sugary drinks tax. Another enabler was the establishment of new advocacy coalitions to really advocate and champion for action on sugar. One example is the Obesity Health Alliance, which is pictured here, that really was set up in response to a behind-the-scenes request from a health minister at the time, who said it would be really useful if there was a dedicated campaign group to really kind of call for this kind of high-impact action ahead of the obesity plan being introduced, just to give them political cover and show that actually there was demand and public support for the measures that they were planning to introduce. There was also, around the same time, the equivalent campaigns being set up against sugary drinks taxes and high-impact obesity prevention policies by the industry. So on this slide, on the right-hand side, you can see an industry coalition-led Can the Tax campaign, where they were coming out with facts and figures showing how the economy was going to be hit by the introduction of a sugary drinks tax, and therefore they were calling for the government to scrap its proposals to introduce this soft drinks tax. There were several other industry campaigns, such as the People Against Sugary Drinks Tax campaign, which was basically led and championed by tobacco and alcohol control lobbyists. But the thing about this particular Can the Tax campaign is they actually not only went against the sugary drinks tax, they actually adopted branding that was very similar to that of the successful Obesity Health Alliance. So their Twitter cards and materials looked almost identical, and they were basically aiming to sow confusion, that you would see this message being promoted by someone you thought was a trusted public health body, but actually it was the industry coming up with these arguments. So the final levy, despite the industry efforts, unfortunately for us, they were unsuccessful, and the final levy was adopted in April 2018. It had 2 objectives: to support product reformulation and reduce portion sizes. It had a 2-tier system where products with lower sugar, less than 5 grams per 100 ml, were taxed at a lower rate, and those with a high level of sugar were taxed at a higher rate. And there was a predicted revenue of 500 million per year that would result from its introduction. And it was very much characterized as a tax on industry rather than a tax on people, hence it's called the soft drinks industry levy. The funding was also earmarked for health. And amongst its impacts, the first one was, at the time of its introduction, it didn't raise as much revenue as was expected, because half of the products which would have been taxed actually ended up being reformulated and the sugar taken out in order for the products to avoid being taxed at implementation. So from a public health perspective, we thought that was already a win, that ahead of the tax being introduced, the industry had already responded. Similarly, a year after the tax was introduced, the volume of soft drinks purchased did not change. So there was no change in people buying soft drinks. However, the sugar from those soft drinks they were buying reduced by around 10% because the industry had taken out the sugar from those products. So it was a kind of win-win for public health, also a win-win for the industry because they were still selling the same amount of products. But there was also no clear distribution in terms of the impact of the product on prices. So while some products went up in price, others went down. Those changes in prices were not linked to the sugar content. They were being changed for other business reasons. And so a summary of how the levy came about and what led to its implementation and adoption was basically there was strong evidence for its effectiveness and impact from the science. There was high-level leadership and support across government departments. In the end, the tax was led by the Treasury. The department is responsible for economics and finance rather than the health department. There was evidence of technical feasibility from the studies, and also the fact that other countries had already introduced their own taxes. There was a coalitions of supportive NGOs, campaigners, and academics producing the evidence showing that there was public support and other political support for introducing the campaign. So yeah, thank you for inviting me, and that's the end of my presentation.
Thank you very much, Modi. Excellent presentation. We're now going to move to South Africa and hear from Mr. Lawrence Mablati, Programs Manager at HELA. And he's going to share experiences of the South Africa SSB tax.
Good evening from South Africa. I'm sure it's good morning across the world. Thank you very much for this opportunity and to CSPI for inviting us to share the South African case study and experience on SSB tax. I will run through my presentation. Okay, so you will see in the framework, in the number of years it took for South Africa to get, the health promotion levy, as we call it here, the SSB tax, from the early years of 2013, the academic institution were starting to gather a lot of research, also learning from other countries, Mexico, Brazil, learning from, the UK. There was still a lot of data that was coming, that was showing overwhelming evidence of the effectiveness of the sugar drinks tax or the health promotion levy, as we call it here. So this is the number of years and the battle, and the process in terms of the parliamentary process, and us lobbying really to get decision makers and policy makers, to yield to the health promotion levy or to yield to SSB tax to be implemented in South Africa. Finally, the president in 2008 signed off on the regulation, and in April 2008 South Africa started implementing the sugar sweetened beverages. It was a bitter sweat. The industry lobbied a lot because the benchmark or the initial proposed health promotion level or SSB tax was at 20%, and South Africa ended up implementing it at 10%, and 3 years from then, it hasn't really significantly increased. It's at 11%. And it has not catch up with inflation. So the industry has really lobbied a lot in terms, even including lobbying unions, which are relevant in South Africa because they are in alliance with the ruling party. So yeah, it has been a bitter sweat and a number of years to get the regulation over the line. So South Africa's health promotion level or SSB tax it's kind of like unique because it excludes some of the of the sugar sweetened beverages. It only applies to what we call cold drinks or soft drinks, but it includes things like nectars, juice. It excludes like flavored water. So those are some of the things that we have been campaigning recently, to get the health promotion levy expanded to include other sugar sweetened beverages over and above the soft drinks. So this graph just shows, the initial proposed levy. Like I've said, when when Treasurer or the Minister of Finance came with the initial proposal, they wanted to use the WHO benchmarked threshold of 20%. But as I've said, it didn't happen because of a lot of pushbacks from the industry, and actually even convincing the trade unions that there will be job losses. So it ended up being like a compromised kind of a regulation. One of the things that we have done well, it was to ensure that this regulation or policy has public support. So from time to time, we will do surveys, right, on public perceptions, and public support in terms of are South Africans really supporting the SSB tax? Because one of the things that the industry using the tactics was like, this coming from Bloomberg, this an American, kind of priority policy. South Africa has a lot of challenges, and we did well by showing that at least 76% of South Africans did support, a cut down in the sugary drinks. Next slide, please. If it hasn't come. You have. Okay. I wanted to talk mainly on the last few things in the spin-offs that we're beginning to see in South Africa in terms of evidence. I was a bit concerned about the time, so I had not included it in the slides, but it will be five of the summit. So there are really very interesting studies that have just come out from South Africa. One showed that since the implementation of the SSB tax, the prices of soft drink has increased, but the prices of non-sugar sweetened beverages have remained the same, such as water. And two other studies that were done, one in South Africa's biggest townships called Soweto, has found that the self-reporting study found that amongst the high consumers of sugary drinks in the household, they have cut down the number of sugary drinks they purchase and by 50%. And another one done in Langa, in a township in the Western Cape province, showed that up to 60% cut down reduction of the sugary drinks. And interestingly enough, recently Coca-Cola has come out publicly that they have actually lost revenue. They've lost about 800 million. Obviously, blaming it on the SSB tax. But I think the good thing is we are seeing evidence is starting to show that the tax is working. The spin-offs, the positive spin-offs of the tax are coming up, and we are continuing to advocate for the original 20% sugary drinks tax that we initially proposed, and recently the Portfolio Committee on Finance and Treasury has committed to undergo evaluation of the SSB tax in South Africa, because we have been putting a lot of pressure in terms of increases through public demonstration, through submission to the portfolio committees, through digital campaigns, through media. And we are starting to see the yield, and we're starting to get the ear, because they have committed, although without specific time frame, they have committed to actually revisit and evaluate the SSB tax in South Africa with an aim of looking at the need for an increased tax. So yes, those are the very interesting thing and the developments in terms that I wanted to put across, that I had not put on the slides, which are absolutely crucial. But the presentation was based on the advocacy work that we have actually put in the case of getting the SSB tax through in South Africa. So thank you very much.
Thank you, Lawrence. Very useful information. Congratulations on the early findings indicating that the tax is successful thus far. We're now going to shift into a question and answer panel, and I invite everyone to turn their cameras on. Our first question is for Guillermo. What type of taxes could be implemented on unhealthy food?
Well, as I was briefly mentioning in my presentation, at the end of my presentation, having these octagons, having these warning labels, tell consumers, or may tell consumers, that the food and beverages that they are about to consume may have some taxes attached to that. So I think that having these warning labels is a very useful thing, a very useful tool to start thinking about implementing these taxes. I believe that if you want to reduce sugar, you have to tax sugar. If you want to reduce sodium, you have to tax sodium content in beverages and food. So basically what you could think about, there are some complexities in the implementation, but they are not unsurmountable. But you could think about taxing the content of sodium, taxing of the content of sugar, taxing the content of fat in each beverage and in each food. In that way, you are also providing a very strong incentive for reformulation, because producers don't like having this warning on their packages and don't like paying taxes. So basically, you are giving them a signal to reformulate.
Thanks, Guillermo. We always hear about the need for a package of nutrition policies, and this is one of the arguments from industry as well. You can't implement these policies in isolation. So I'm wondering, Lawrence, are there plans on your end to move ahead with or to consider front of package warning labels, and what does that look like? Where are you in that process?
Yeah, thank you very much. So South Africa is moving ahead. We've been pushing. We are just coming from the convening by the National Department of Health, the convening that was actually presenting the data on the front of pack warning labels. And the next steps now is to move with public consultations or public comments process. And we believe South Africa very soon will have the front of pack label. And we have seen that the industry has actually been consulted on the site, and they have we know, even with the lessons from other countries, things that we can expect and we can counter. We are learning from Mexico, we're learning from Brazil. We know the kind of tactics that they would be putting. But South Africa is moving ahead, and very soon we will have the front of pack warning label. The data has been presented, the industry and the civil society, because we demanded for a joint civil society and industry data presentation meeting, and the industry not being consulted aside or be given preference. So we had a very successful data sharing result by the University of Western Cape that was convened by the National Department of Health. The push ahead now is to get the public comments, the public consultation process underway without further delays.
Thanks, Lawrence. I think as advocates, we've all been grappling with this kind of policy inertia for the past few years, right? How do we get our policymakers to move ahead and implement these policies that we know are evidence-based? And you've seen the evidence is mounting. How can we use, we're in the midst of a pandemic right now, and it's shown the vulnerability. If you have an NCD or obesity, you're more likely to have severe COVID disease and mortality increases. We left the pandemic to encourage policymakers to begin to fast track these types of policies. I know, Alejandro, in Mexico, you very effectively used this type of messaging. Can you share a bit about that?
Yeah, it's very complex, the situation in Mexico. We have, like in many countries, a great division, political division, no, and this increased in this government. But the person that is in charge of the pandemic from the government, that gives the reports all days at night, he put a lot of attention in the obesity process, no, the obesity pandemic in Mexico, the diabetes pandemic, and also from the civil society, we show a lot this situation, and also show the strategy from the industry to give a good image, no, giving food to the doctors in the hospitals, and also promoting many different products, or giving these products directly to population that are in vulnerable conditions. No, but I want to introduce another thing that I think is important. For us, a great dilemma is about reformulation, because also in the case of Mexico, that we include this no caloric sweetener, no warning level for children and caffeine. No, we are looking at the reformulation is not for healthy products. No, the great dilemma is how we can promote that the people begin to eat more real foods. No.
Yeah.
I think that this kind of reformulation with new ingredients that are not healthy is good, not to reduce sugar consumption, sodium, fat, no, but we need to recover our diet, our traditional diet, our real food.
Thanks, Alejandro. Turning to you, Modi, have you, and picking up on what Alejandro said, we've often seen that sometimes these communication campaigns, in tandem with promotion of the policies that we're looking for, there's also this promotion of returning to the basics. And how do we go back to traditional types of foods and, fresh fruits and vegetables? Is that something that it's been happening in the UK? I think your mic is muted.
I'm so sorry. Yeah, I would say if only that was happening in the UK. I absolutely agree with what Alejandro was just saying around really the solutions we need to this problem is a shift to, traditional sustainable diets, real food, whole fruits and vegetables, pulses, things like potatoes, rice, cereals, whole grains, rather than, eating reformulated products with slightly less sugar, perhaps some artificial sweeteners. And, as a nutritionist, I've been arguing this for years, and it really breaks my heart that obesity and health promotion policies pretty much around the world focus on taxing the junk food, restricting the marketing, rather than promoting the positive, protective foods that we should actually be eating. The presentation I presented earlier or today around my work on the sufferings industry levy was when I was working in a public health job. Now I'm working at the Wellcome Trust. My job is more around the transition towards sustainable diets. And when you start thinking about both the health and the environmental considerations of food, it takes you away from a narrow focus on the junk foods to the other types of protective foods that you should be eating. And I think that's definitely something that needs to be put at the heart of this obesity problem. But actually, it's a healthy diet problem, diet-related diseases rather than just even obesity. I think the focus that has historically been had on solving obesity leads you down the calories, sugar, junk food, rather than if you're looking at diet-related diseases and the need to also increase fiber intakes, which most people around the world aren't meeting the fiber targets. Most people aren't eating enough fruit and vegetables. Those kinds of foods. Most people aren't eating enough beans and pulses. Those protective traditional food dietary trends are going down. So I'd strongly recommend a shift towards everything within the Eat Well guides, the dietary guidelines, the food pyramids that countries have is what we should really be focusing on. I think Brazil has been making, recently updated its comprehensive food-based dietary guidelines and has been making some progress towards supporting those traditional diets and thinking about more protective foods. But I don't think there are many countries who have actually had those comprehensive policies that are much broader than a focus on obesity and junk food.
Yeah, I think part of that too, which we've seen, is the tremendous investment in marketing. So while we're promoting these healthy foods, we really have to deal with marketing, because marketing is really directing children and adults towards certain types of foods. And the type of legislation we see in Chile, as Guillermo was saying, when we know you have a label on a food, and that label now defines whether that product should be taxed, whether or not it should be regulated for marketing, is extremely helpful. And the UK has also recently announced really strong policies around digital marketing, which is very relevant now in this COVID space where children are on screens, virtually all day long. So I think marketing is another area that we really need to start to tackle, and it's a challenging one. We're getting close to the end of the session, so I'm going to invite each of you to provide a quick closing takeaway remark, where you go, what's next for you, what lessons do you have for the audience that's watching, that's based largely in the US, as the session experiences from abroad. And so I'll invite Guillermo to begin, and then Alejandro and Modi and Lawrence.
Yes, I would say from my side that all these threats and ghosts that the industry always agitate when measures like these ones are being discussed are mostly that, ghosts. They don't exist. What we know, not only from food warnings or food labelings, but also from taxes, is that they don't have any real effect in terms of employment, wages, or any variable that may concern people. So we have to insist on these measures and show clearly the enormous gain that they have in terms of public health.
Alejandro?
Yes, I think it's important to have a world picture of the food system, no? Because the only way to change this situation is, as mentioned before, to have a sustainable food system, healthy food system, and a food system that give more justice, social justice, no? And the interference of the big corporations, no, and the conflict of interest in the creation of public policies, no, from people or related or in link with these corporations, is a great obstacle to go. And I think that the summit that we will have this year on food systems is one example of this situation. And I hope that we have a very strong battle in the media, not with the civil society voices, not showing this interference, because we need a sustainable food system that also needs to be a healthy and just food system.
Thank you. Modi?
Absolutely endorse Alejandro's point. Let's put healthy and sustainable food systems at the heart of our efforts to tackle diet-related diseases. In addition, we need to shift our focus from the junk foods. We need to continue focusing on reducing the bad, but then increase our focus on the good. So the protective foods, which include whole grains, cereals, fruits and vegetables, beans and pulses. We need much more of a spotlight on their importance. Also, policy making to date has really focused, in addition to focusing on taxing and reducing the bad, there hasn't been enough focus on the producers of those protective foods. Let's get them involved in the debate. As public health actors, why don't we start partnering with some of those better food producers and get them involved in helping us to develop solutions that actually promote more of the good, as opposed to just focusing on reducing the bad.
Thanks, Modi. And I think we're almost out of time. So Lawrence, just a quick summary word out for us.
Yeah, I think we need to continue demonstrating that food policy issues are human rights issues. I think we need to build this collaboration and regional like international solidarity. Have cross learning. We need to have in country kind of like provincial kind of laws and and policies that actually we can promote for schools. And I think for countries that have already defined what is unhealthy food and what's healthy food through the front of pack, I think the next step is to actually call for a junk food tax, and as a next follow-up advocacy priorities.
Thank you, Lawrence. A perfect way to end our session. Food policy issues are human rights issues. I hope you enjoyed our session. Thanks very much, and enjoy the rest of the day.